Hi everyone, my name is Dr. Hassan Noyan, and my oral presentation is on my QUIP project, Preventing the Preventable, which is enhancing VTE assessments on geriatric wards. So, venous thromboembolism is a leading cause of preventable hospital morbidity and mortality, usually in the form of PEs, and older adults are particularly high risk due to immobility, frailty, and other comorbidities that they have. So there's already nice guidelines on this, which says that all hospital inpatients must undergo a documented VTE risk assessment, and then another risk assessment within 24 hours. And the reason I did this is because I personally observed a lack of completion of these forms, as well as awareness on how the VTE risk assessment forms are done, at least in my trust. So the aims and standards are to improve VT risk assessment form completions for patients on across two wards, really. Let's call them X and Y. And the standard is 100% of the VT risk assessments to be completed on ward X and Y in our local trust. So the methods were quite simple. So step one was all patients on both wards were audited on their VT risk assessments. This was over a period of 4 separate days over a 3 week period. Step two was we did a teaching presentation at our weekly departmental teaching with discussions on NICE guidelines, the importance of VTE prophylaxis, and tutoring of basically how to complete the assessment. After this, we also printed and hung up some information leaflets as guidance for resident doctors and displayed this in the doctor's office, outlining the steps required to complete a VTE risk assessment form. And about 2 weeks later, we conducted a second cycle of audit, which was completed after we enacted these changes. And again, we reviewed all the data over 4 separate days over a 3 week period, and all patients across both wards were audited. Our results are so divided into pre-intervention, post-intervention. So pre-intervention VTE completion rates were about 86% on Ward X and 80% on Ward Y. Following our change, it was 92.5% on Ward X and 98.4% on Ward Y. So it's an increase of 6.5% and 18.4% respectively, which is a step in the right direction. So basically, the takeaway is a simple low cost intervention which involves resident doctor education and visual prompts, basically improve VT risk assessment, form completion across the two wards we audited. And I think sustaining improvements will require ongoing reinforcements and regular updates. So I think it's quite clear that broader adoption of this approach could reduce preventable hospital-acquired VTE because we're doing more assessments in vulnerable older patients. So in terms of our next steps and where we're taking this audit is we're going to repeat this across subsequent rotations when new doctors rotate just to assess its effectiveness. With subsequent cycles of data, we can see whether or not this is something that we needed to add to our departmental induction. So the resources that we used, so the presentation used in resident doctor education and the poster is available on these QR codes. Thank you very much for your time.